Welcome back to the TradNurse podcast. This is episode 15, and this show is for bedside nurses who are done with the fluff and ready for the truth. I'm Christine, your host, and today we're going to discuss 10 skills every MedSurg nurse must own in 2025. If you don't memorize these or have them on your clipboard and refer to them often, you're just surviving, not thriving. I know how much nurses dislike floating to MedSurg. I hear it all the time. The staffing ratios are 1 nurse to every 5 patients. This varies from state to state, and it can also be 1 nurse to 6 or 7 patients on night shift. Plus, with the increased level of acuity of patients on MedSurg, this can make or break a nurse. So today is a straight up locker room talk. No guest, no ads in the middle, just me giving you the 10 skills that separate the nurses who leave crying from the nurses everyone wants to work with. You can print these checklists out, laminate it, type it to your clipboard. I will put a description in the notes below. Let's dive in. Skill number 1, early recognition of deterioration. Own your news 2 like your license depends on it. What is news 2, you say? There's the news 2 is the new 2025 version. There's just an older news version, but both are early warning scores to recognize deterioration. Simple bedside tools that turn routine vital signs into a single number score. So you can spot a deteriorating patient hours before they crash. Respiratory rate over 24, new confusion, your SATs are tanking on 6 liters. That's your patient trying to tell you that they're crashing. There is a separate oxygen scale for chronic CO2 retainers, your COPD patients. A single red score of 3 means you call respiratory before you even think about charting anything. Studies show catching this early cuts failure to rescue by 35%. Keep a copy of your News 2 scorecard on your clipboard. The link will be in the notes below. Skill number 2, the 3-minute head-to-toe assessment. You do not have 15 minutes per patient to do a thorough assessment. You're going to focus on mental status. Are they alert? Are they having any confusion? Or is there a new confusion? Airway, breathing, lung sounds, respiratory rate, O2 SATs. Are they on any devices, a CPAP or a BiPAP? Circulation. What's their cap refill? What are their pulses like? What is their skin temperature? Are they on telemetry? Your lines, drains, tubes, are they patent? Are they labeled? Neuro. Do they move all 4 extremities? Is their grip equal? Skin. Are there pressure injuries? Are there rashes? Are there dressing changes? Pain. What is their pain level? When was their last pain med? These are 7 things. Mental status, 2, airway, breathing, 3, circulation, 4, lines, drains, tubes, 5, neuro, 6, skin, 7, pain. 3 minutes, memorize them, do it the same way every single time for every single patient, and you'll catch every new bleed, pneumonia, stroke before the doctor ever walks in. Skill number 3, know the first 30 minutes of the top 8 killers. Sepsis, PE, GI bleed, DKA, diabetic ketoacidosis, acute kidney, AFib, hyperkalemia, and bowel obstruction. If you hesitate on these, the patient has a higher risk of death. I can go through them. Sepsis, if Quicksilver greater or equal to 2, you're going to give lactate, check their blood cultures, and a 30 milliliter per kilo bolus, plus broad antibiotics. PE, you're going to get a stat CT for a PE or a bedside echo. GI bleed, 2 large bore IVs, type and cross, and pantoprazole drip. DKA, check potassium, start insulin drip, aggressive fluids. Acute renal, stop nephrotoxins, strict INO, ultrasound, if no urine. Atrial fib, the goal is to keep the rate below 110, beta blockers, or a cardizem drip. Hyperkalemia, look for EKG changes. Calcium gluconate, stat. Bowel obstruction, MPO, NG tube, surgical consult. Skill number 4, time management that actually works. Every nurse has their gifts. I was really good at time management. I would focus on what I had to do, triage, prioritize the things that were important, let go of the things that weren't so important. So stop running around like a headless chicken. Cluster your 9 a.m. and 11 a.m. meds and finger sticks. Do a 5-minute bedside report, round every odd hour on the day shift. 1 month of doing this, and you will cut your overtime in half and actually have time to chart. Stay focused on your patients, and you will get everything done in your shift. Skill number 5, zero harm mobility. If your patient falls on your shift, you failed twice. You failed for them falling, and your back is going to feel it. So always check for bed alarm, call light in hand, nod skid socks, hourly rounding documented. Falls drop over 50% when nurses actually do this. It's not the aides that are responsible for this. It is the RN to make sure that your patient doesn't fall. Skill number 6, high alert medication mastery. So these are your insulin, your heparin. Check your PTT on your heparin, your IV opioids, and your potassium riders. Are they on a cardiac monitor if you're giving them potassium? 2 RNs to sign off every single time, no exceptions, no but we're short excuses. 1 wrong decimal and you're getting a lawyer and are on the news. Check your pumps, your mic per kilo per minute drips. Are your pumps programmed right? Are your alarm limits set? Skill number 7, basic EKG interpretation. You don't need to be a cardiologist, but you better recognize STEMI, a new left bundle branch block, T waves, and complete heart block. As a nurse, I've called 2 STEMIs from the floor because I saw it first. The door to balloon time starts with you, the RN. So a 30-second checklist, what is the rate? Is it greater than 150? Is it less than 50? Is it regular or irregular? Is it wide or narrow? Is there ST elevation greater than 1 millimeter in 2 leads? Call a code STEMI. Is there new left bundle branch block plus also symptoms, chest pain, shortness of breath, nausea? Call a STEMI. Are there peak T waves plus hyperkalemia? Is it greater than 6.5? They'll need calcium now. And 2nd degree type 2 block, or is there a 3rd degree type 2 block? Call respiratory and get your transcutaneous pacer pads ready. Skill number 8, delirium prevention. The A, B, C, D, E, F bundle. Do it every shift. Assess, wake up, breathe, choose light sedation, delirium screen, early mobility out of bed, family support. One hospital I worked at cut delirium by 40% just by getting people out of bed 3 times a day. And it's just crazy what walking does for the mind. Skill number 9, flawless handoffs. Use the iPass system. The handoff is very important. First, illness severity. Are they stable? Are they unstable? Are they a watcher? Patient summary. Action list. What needs to be done in the next 12 hours? And then situation awareness. If X happens, do this. And make the oncoming nurse read it back every time. And sometimes you may have to go to the bedside to explain the IV lines or something at the bedside. And finally, skill number 10, treat burnout prevention like a clinical skill. A 2-minute reset at the end of your shift. Text a nurse friend about your day before taking it home to family. Write 1 win from the day. If you're busy and you have to leave something undone, document it, report it. Your emotional exhaustion score literally predicts patient mortality. This has been researched, and you can look that up. So here's the truth nobody says out loud. MedSurg is still the hardest place to work in the hospital. You are not just a floor nurse. You're in the first and last line of defense for between 5 to 6 to 7 humans who will live or die based on what you catch in the next 12 hours. So stop waiting for the perfect assignment or the perfect manager or the perfect job. If you mastered these 10 things, you will become bulletproof. Please copy and print out the 10 skills checklist, add it to your clipboard. There are no strings attached from me because I'm just tired of hearing about how hard it is to float to MedSurg and people will resign from their jobs because of it. And I'm tired of also watching good nurses go down. These are things that everybody can learn. So drop in the comments or DM me on Instagram at TradNurse. Which one of these 10 are you strongest at right now? And which one are you committing to level up before 2026? I'm holding you accountable. Until next time, stay sharp, stay kind to yourself, and keep owning the floor. If this episode helped you, share it with one burned out MedSurg nurse bestie. We rise together or we don't rise at all. See you next episode.